What I shall to do is just try to do it just to give you an idea of how difficult it is to implement a person-centered medical curriculum, and how necessary it is in order to implement person-centered medicine to go back to change the curriculum and to adapt it to these new needs and to this new vision. So 3 questions. Is it the person-centered medical curriculum a realistic project? The answer is yes. How to implement it? The answer is it is difficult, but it can be done. And should we offer help to curriculum planners? And this comes to the proposal of having conference and publications on this particular field. Because otherwise, we're not going to get to the point of having person-centered medicine actually implemented in practice. I think there are 5 steps to introduce person-centered medical education. The first one is to recruit or support a leader able to motivate the faculty. And this is the most important thing. If we continue to have faculties who are not eager to change the curriculum, we are not going to have person-centered medicine. And this is a big problem. We have to reach a strong agreement with the faculty in a series of topics which are not going through, of course, but which are absolutely essential, because if faculty do not understand the sense and the importance of this new point of view, we can do everything we want, but we will not get to the point, in my opinion. We need to plan workshops for the faculty, but we do not have to run them by ourselves, because nemo profeta in patria. And this is another trick which we have to use, because otherwise it won't work. And we have to be patient. We don't have to force a faculty, we have to negotiate. So, is it possible to do that? Yes, we think it is possible. I think it is possible. And the University of Milan, 3 years ago, it has opened a new project, which is a patient/person-centered curriculum, international one, in English, open to students from all over the world, and based on just the principles we have been talking about in the last 2 days. So just to give an idea, the very first part of the curriculum is dedicated to the introduction to medical profession, from the very beginning, to give to the students the idea that becoming a doctor is not just putting a brick over a brick over a brick, but just to have a comprehensive view as large as possible of the problems which the students will encounter during their actual profession. So, and then you have to study and to run a curriculum which keeps the concept of person-centered medicine throughout all the 6 years. We have a 6-year curriculums. In England there is a 5-year curriculum, but it's just the same. And we have to insist that this concept has to change the way of teaching. And we have to use a great variety of techniques and methods, teaching methods, in order to have the students really metabolizing the concept of a new view of medicine. For instance, just to give you an example, very short, to teach history taking, or to have the students to learn how to take history, we have to give this, and this is what we do, we have to give them this list, which is not just fill in a medical report, but it's just to try to understand and to get in touch with the student in a completely different way from the one we have been used to. And, of course, again, in physical examination, so to answer to the questions, to come to the conclusion, a person-centered curriculum appears to be highly feasible, provided a solid cultural background by the faculty and a motivated leadership be present. To implement it, the curriculum planning is central and critical to the project, And then we have to study, of course, previous experiences. We have to plan it very carefully, and we have to have a gentle, positive attitude, because faculty do not like changes everywhere in the world. We know that. And this is absolutely critical. We have to be very gentle and to take the faculty up to understand a new way of thinking, a new way of learning instead of new way of teaching. We have to teach to learn, not to teach to do. We have to teach how to learn. And we have to abandon the idea that teaching is teacher-centered or disease-centered, as it was. It could be patient-centered, but in the last 2 days, I learned that the idea of a person-centered is much better than patient-centered, because it enlarges the view and the sight to the world outside the patient and outside the doctor-patient relationships, introducing relationships with a variety of conditions which are totally outside. And because a person is a person, and it does not necessarily have to be a patient. It can be a patient, and eventually it will be a patient, but medicine must take care of a person even before the person becomes a patient. And this includes a very profound change on our view of medical education. So the final answer to the question is, how about introducing medical education in the series which Professor Myers has just presented to us? Thank you.